Hello everyone, my name is Vladimir Brusantov, and today I'll be presenting about anemia and sickle cell disease in particular. So what is anemia? Anemia is a deficiency in the number of erythrocytes, as you can see in the picture on the right. The quantity quality of hemoglobin, the volume of packed red blood cells, or the combination of those. Before I talk about sickle cell disease, it's important to review the hemoglobin structure, which you can see on the right. Hemoglobin is an oxygen-carrying protein in red blood cells. Hemoglobin is made up of 4 hemoglobin chains. There's 2 alpha chains and 2 beta chains that coalesce together to form the hemoglobin molecule. Sickle cell disease is an inherited disorder, which in abnormal hemoglobin S for sickle cell, can lead to chronic hemolytic anemia, pain, and organ failure. Hemoglobin S is a recessive gene. It can manifest as having sickle cell trait, being heterozygote or a carrier, or having a sickle cell disease, which is being homozygous recessive. It mostly affects people with African ancestry, and in parts of Africa where malaria is endemic, the gene frequency can approach 40%, since sickle cell disease has a protective effect against malaria. The etiology of sickle cell disease is that it gets its name from the sickled appearance red blood cell, as you can see above, which is caused by abnormal structure of hemoglobin S that occur from a single point mutation in the beta chain of hemoglobin. Heterozygote individual, around 40% of hemoglobin is in hemoglobin S form, but in homozygote recessive, there is a prevalence of 80 to 95% of hemoglobin S. Hemoglobin S can become sickled when deoxygenated, and deoxygenated hemoglobin aggregates and polymerizes in the cytoplasm, creating a semi-solid gel that changes the shape and deformity of the cell. And carriers, they don't have as many symptoms as homozygous recessives, since there's a difference in hemoglobin S in these two cases. Sickled cell can return back to normal with oxygenation in the lungs. However, repeated episodes of deoxygenation can make the cell permanently sickled. It can lead to chronic hemolytic anemia and blood vessel occlusion. Premature destruction of the red blood cells due to rigid non-deformable membrane occurs in the spleen, causing hemolysis and anemia from a drop in the red blood cell levels. The clinical course of sickle cell disease is just massive. You can see in the picture on the right, it can affect anything in the body from head to toe. It can affect a lot of organs, and hemoglobin S homozygotes can experience severe hemolytic anemia, chronic hyperbilirubinemia, vaso-occlusive crisis. Hematocrit can drop to 18-30%, where it's usually 40 to 50% in men. Hyperbilirubinemia can lead to jaundice and the production of pigment stones in gallbladder. Acute pain episode and hypoxia due to vessel occlusion can happen in any part of the body. Common sites are abdomen, chest, bones, and joints. Pain can be accompanied by fever, swelling, tenderness, tachypnea, hypertension, vomiting, and nausea. It can also lead to lethargy as well. Infarctions due to sluggish blood flow can cause chronic damage to the liver, spleen, heart, kidneys, and retina. Approximately 11% of people with sickle cell disease have sudden strokes by the age of 20, along with transient ischemic attacks or cerebral hemorrhaging. Spleen is especially susceptible in people with sickle cell disease, where sluggish blood flow can cause functional asplenia. It can lead to predisposing the person to life-threatening infections by encapsulated organisms, like S. pneumonia, leading to pneumonia. Acute chest syndrome is a big manifestation of sickle cell disease, which can be life-threatening, where it's an atypical pneumonia resulting from the pulmonary infarction. It's a leading cause of hospitalizations in persons with sickle cell disease, and the signs and symptoms are shortness of breath, fever, chest pain, and cough. Acute chest syndrome can also cause chronic respiratory insufficiency and is the leading cause of death in sickle cell disease. And on the right, you can see different chest x-rays of the same person, where as time goes on, there's more liquid in the lungs, leading to more white spots in the lung field. Sickle cell crisis is another important clinical manifestation that can be life-threatening, which is a severe, painful, and acute exacerbation of red blood cell sickling that causes a vaso-occlusive crisis. Progression is from impaired blood flow by sickled cells that causes a vasospasm, which further reduces blood flow. Severe capillary hypoxia leads to development of thrombi and circulatory stagnation that can lead to tissue ischemia, infarction, and necrosis can occur from the lack of circulating oxygen. Sickle cell crisis can begin suddenly and can persist for days to weeks. How do you diagnose sickle cell disease? Well, it's simple. You do peripheral blood smears, which may reveal sickled cells in normal reticulocytes. Sickling tests also test for the presence of hemoglobin S. Hemoglobin electrophoresis can be done to determine the proportion of hemoglobin S to other hemoglobins. MRI can also test for the presence of vessel occlusions in the brain and strokes, and you can see on the right the difference in appearance of normal blood cell compared to sickle cell. And is there a cure for sickle cell anemia? Unfortunately, not. Currently, there's no cure for sickle cell disease, but treatment strategies focus on prevention of sickling episodes, symptom management, and treatment of complications. Patients devise to avoid situations that can lead to sickling episodes, such as infections, cold exposure, severe physical exertion, acidosis, and dehydration, which can all lead to the oxygenation of hemoglobin that can lead to sickling. Blood transfusion may be given in crisis situation, and immunizations are strongly suggested. The There is, however, a drug that can be used for sickle cell disease, which is called hydroxyurea. It's a cytotoxic drug used to prevent complications of sickle cell disease. Hydroxyurea allows synthesis of more hemoglobin F for fetal hemoglobin, and less hemoglobin S, therefore reducing sickling. Hydroxyurea also decreases the reactive neutrophil count, increases erythrocyte volume and hydration, and alters the adhesion of sickled erythrocytes to the endothelium. And in very extreme cases, since this is very rare, if there's a donor of blood marrow available, bone marrow transplantation can also be done. And that concludes my presentation. Thank you for listening.